Good morning, everybody. Good morning, everybody, and welcome to AM Impact on Your Health. AM Impact on Your Health, where every day our goal is to have you learn at least one thing to help you live better and longer. AM Impact on Your Health is heard each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney, and I'm with you each and every Monday, Wednesday, and Friday from 8 to 9. AM Impact on Your Health, where each day you'll find current medical news, knowledgeable guests, fascinating health topics, and of course where we do encourage you to call in to join in. Today, well, I'm going to bring a new concept to the table. It's in keeping with a theme that kept on ticking since we were introduced with Ty Vincent this past December. And he continues to come on the show with a whole bunch of hope and sunshine coming through the windows of some pretty serious disease, Lyme disease being one of them. But some revelations are now ready to be admitted for me because I've been experiencing some good results in treating Lyme that lead to a conclusion, well, I just needed to make. And so you're going to be hearing today about something called AZT, known as Ozone Therapy. I'll explain my madness in just a moment. I think it all fits, and I'll be happy to explain it as the morning moves on. Now, look, if in the conversation this morning you want to call in to ask a question or make a comment about ozone therapy, ultraviolet blood irradiation, low-dose immunotherapy, hey, how about microcurrent? More on that subject in just a moment, too. A lot of fascinating things happening here. The practice is really burgeoning. A lot of excitement in the air, and I hope that gets translated to you who listen to these shows and are out there, maybe extremely healthy. I hope so. But if not, and you're looking for something to turn the tide with what's going on with you, I think you got to come in to see us and set up an appointment to come on in and let's talk about it. Now, let's take a look at the schedule and see how it is shaping up. On Friday, we're going to have an open phone as we do each and every Friday. But we're going to do at least a Beresha report because there's up-and-coming events with Beresha. And then we're going to meet with, her name is Bethany Neri, and she's one of the co-partners with Michelle Garlitz, who run an organization they call HEAT. Now, it's a pretty nice play on words because they deal with heat each and every day, body heat, that is, and they record it in a fashion that's visual called thermography. And we have been a fan of thermography for many years around here. Turns out there really are two groups in the western Pennsylvania area that deal with the treatment of it. Both are fantastic in what they do. One, Three Rivers Thermography, travels all over western Pennsylvania. A newer group maybe does a little less traveling, but is very conveniently located for those people who live in the South Hills. And they're called HEAT. They are located at 110 Fort Catch Road. And I'm giving them a little plug. I'm always in favor of helping out folks that offer to the public ways that they can control their own health. I think thermography is one of those ways, especially trying to rid ourselves of the dastardly mammogram, which really aren't worth the paper they're printed on. So if you want to learn more about thermography, first of all, tune into our show on Friday where Bethany will try to give you a little bit of a glimpse behind the scenes of how thermography is done, and of course to invite you also to their open house that they'll be having this coming week, next week on the 28th, going to be held at their offices at 110 Fort Catch Road, directly across the street from the institution that all women know called South Hills Village, and they're going to have that open house from 4 to 7. You'll meet Bethany on Friday, along with more than likely Dr. Angela Mitsos, and then we're going to open them up as we normally should each and every Friday for you to set an open phone agenda. Now, of course, Dr. Mitsos represents all that's going well with this Beresha phenomenon and the Beresha experience. Speaking of the experience, it's coming to town in the form of Joe Giuliano, who's the #1 salesperson in the country when it comes to Beresha. He is from Pittsburgh. He hails from Pittsburgh, lives in Indiana now, but he frequently comes to town, and he's going to be here next week on, Monday. He's going to be out there at Balance for Wellness out in the North Hills on Route 8 at the physical therapy operation of Dr. Lloyd Lankowitz, and that's going to be at 6 o'clock. So that's one place that you'll be able to enjoy a tasting of all of Aresha products, as well as hear a little bit about the company and the products from Joe. And if you're in the South Hills and you want to meet Joe and learn more about Aresha also, that experience is going to be held the following evening, and that's going to be at 6 o'clock at the Crown Plaza, oddly enough, across from the same edifice called South Hills Village as the Heat organization was I mentioned a moment ago. So Aresha's coming to town, giving you an opportunity to taste the products. They're one of a kind. If you want to try a sample of them, come on in to see me. I'll give you a free sample of many of these things. Also, too, you may just want to try, if it's in your zip code, your area, you just want to maybe try to stop by and taste it on us and see if you want to be at least getting the product. You may even want to sell the product, and Joe will help you get steered into that. Okay. Also looking at the schedule now, Shannon Gosen, who was our guest on Monday, as she is each and every month, we've set a Monday aside called Microcurrent Mondays. It just seems so appropriate to have it on a Monday. And we were talking a lot about microcurrent. And the fact we revealed to you that Shannon will be coming to town. She's going to spend all day in my office on Friday. We're going to be reviewing, I think there's 10 or 12 patients that already are patients of mine. We've developed programs for them. We're going to see if we need to tweak those programs a bit. So Shannon's going to be in the office all day dealing with patients already scheduled. But we're getting a lot of inquiry, a lot of interest is happening because of these shows about microcurrent, and many people way over and above those I've already seen have an interest. If you'd like to learn more about microcurrent and how it may be beneficial to you, but you just don't know enough about it, Shannon did something very nice the other day. She had an open invite for the first 25 people that wanted to come and have an opportunity to meet Shannon and have Shannon literally discuss microcurrent and maybe get some generalized approaches that she could pass on to those who are in the group. Now, if you think you want to be a part of that group, and it is growing, we haven't hit the 25 yet, but I got to think maybe today we will. Give us a call at 724-942-3002 so that we can reserve a seat for you, and you'll have a chance to meet Shannon. Now, that's going to be on the 31st, which is a Saturday, at 10 o'clock. So she'll be out of town the very next day and back to her hometown of Jacksonville, Florida. But she is she's no stranger to Western Pennsylvania, certainly no stranger to Pittsburgh. And this back in the 1990s when she first, we brought her up here so often and to learn about her passion, her avocation, which was working with myofascial disease, and the great Janet Travell, who actually became very close friends there before Janet died back in the 1995 era. Anyway, if you're interested in microcurrent, you learned, by the way, I think should pass that message on to you. We talked about it on Monday. We tried to find out from Shannon and her perspective, look, how does a consumer know, how does a potential patient know that the microcurrent that their clinicians are proposing for them is actually okay for them? And I threw the question out there. I thought her answer was interesting. Let me sort of pose for conversation purposes how she answered it, because I thought that she hit the ball right out of the park. First of all, she said, all microcurrent devices are good. Now that's a great big broad sweeping brush to paint that, but there's not a bad microcurrent device out there. Now there may be bad millicurrent devices, the TENS units, because the amount of power is just so overpowering that although it won't harm you, it might not, and more than likely won't, be beneficial to correcting the problem for which you're using it. The old days of the TENS unit, electrical stimulation and the use of electricity at its beginnings involved current that was just too potent, just too powerful, because it was measured in milliamperes, which are thousandths of an amp. I know that sounds very small, but when you compare that to microcurrent, where we're using millionths of an amp, the realization that there's quite a difference between utilizing the old TENS units and microcurrent units, which are used today. So Shannon was pretty, she was not shy about answering just in general. All microcurrent, that which is measured in millionths of an ampere, is good. The earlier devices, however, were single channel devices that only emitted one frequency, one constant flow of energy, and as such lose a great potential because they're not programmable. So the other point she made is the top of the line now is a microcurrent device, which is a dual channeled, 2 channels, FSM device, stands for frequency specific microcurrent device, where the 2 channels are devoted, number 1, to assessing and providing the correct healthy frequency for the tissue involved. That's channel A. And channel B, to be able to counteract and prevent the further propagation of the pathology, which also has its own frequency, in channel B. So we won't get any further down the weeds in that. It's just, I think it was a good recap that what we learned on Monday. You should always remain an educated consumer, that you'll be able to ask the right questions. Question number 1, is that device that you're using and you're recommending for me in the milliamperage range or the microamp range? That's self-explanatory now about how you're really looking for the correct answer to be microamps, which is millionths of an amp. Number 2, is this a programmable device or not? If it isn't, it's still good. Don't misunderstand me. Shannon was really clear about that. Nonetheless, it can be made completely beneficial if it is a programmable device, dual channeled, frequency specific, channel 1 used to program the proper frequency for the tissue involved, and number 2, to counteract the pathology involved with channel B. And that's my, in a nutshell, version of what went on Monday. And if you're interested in becoming a member of that group for January 31st, 10 o'clock in the morning here in my office, give us a call at 724-942-3002. That's 724-942-3002. Should also mention that today we're going to finish up with our January 3-day eye treatment protocol that, of course, Dr. Ed Condra put together. And just letting you know that the February group, the February eye treatment program, is going to be held on February 16th, 17th, and 18th. That's 16, 17, and 18. And if you'd like to be a part of it or would like to learn more about it to maybe be a part of it, give us a call here at 724-942-3002. You want to talk to Sister Sarah, and she'll help guide you in here to make a soft landing and be available and ready to go February 16, 17, and 18. And I think that just about rounds it up. Oh, one other thing I want to mention. There was, and I don't know why there was this difficulty with the show that I did. It was 1 week ago. And on that show, I described what I call the list, the LDI list, all of the autoimmune diseases that actually have an opportunity to be treated by LDA/LDI. Those of you who listen to the show, I think you can glom onto those initials pretty easily. But then when I checked, Bill was telling me off air that somebody called, and we want to thank you, saying that you went to the website and when you got to the program, it was just blank. And doggone if I didn't check it out, and that's actually was accurate. However, thanks to the help of Bill, we were able to get a copy of the show have my techie put it up. So I can tell you now, if you want to go to the show that we did on LDI, the list of all the autoimmune diseases that will respond to low dose immunotherapy, you want to go to the show of January 14th by going to the website at DennisJCourtneyMD.com or at DJCMD.com. On the opening page, click on the icon marked Archives and go right, well, actually the show is right on top now because it was placed a little out of sequence. Look for January 14th. Now I will say my list is mounting. I was just scribbling this down as I was going on the air today. There will be, well, there are right now 1, 2, 3 shows that have been dedicated to LDI. Today's show, when I get done talking about what I now refer to as AZT, you'll see what I mean, that'll be the 4th show. And there'll be one more show that I think that we're going to be able to record in February. We're going to try to have it a live show. At least that is his intention. I'm talking about Dr. Ty Vincent. So I'm seeing that there is a group of 5 shows that ultimately I've got to get on a disc, or I think I'm going to need to put them on a couple discs. But you'll be able to dial them up free of charge by going to my website at any time. But others of you may want to have a copy of this, and I will tell you that my ultimate goal is to get all 5 shows, 3 with Ty Vincent, 1 show called The List, and then this show today with this little new component that I call AZT. And then I'm going to talk about in just a moment. And that's what it is this morning, and we'll let it go at that. All right, let's do this. I'm going to take a short break. When I come back, I have been scouring my notes, everything I can read, and I've been watching how my patients are reacting to Lyme disease treatment, and I got to bring that message to you, and how we can now tweak this to make certain that we get 100% correction of Lyme. Now, wouldn't that be wonderful? I say it's possible. I say it's happening. Be right back in a moment with AZT. Good morning, ladies and gentlemen. Welcome back once again to AIM Impact on Your Health. Right here in KHB 620 each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney with you today on a Wednesday morning version of the show, and I'm going to take the helm for just a little bit. Every time I come up with something I learn, I always share it with you, and I think as the topic has gone on here for a number of months now, this discussion of autoimmune disease and Lyme disease and a whole host of others, and the thrilling and very exciting year coming up using low-dose immunotherapy, I thought I would just share with you what I'm rapidly learning to be the way to be 100% effective and 100% correctable when it comes to these serious diseases like Lyme's. Now, you remember back in the day when we first met Dr. Frank Schallenberger, and we were first learning about ozone therapy. They seemed to tack the word zone on the end of anything and came up with a treatment. Like there was, of course, ozone therapy itself, and then Frank was dabbling in how to inject ozone in a joint using a prolotherapy approach and using procaine, and that evolved into becoming something called prolozone. And then Frank decided, well, he was going to team up ozone with chelation therapy, and then that became a treatment that he coined kilozone. And so in keeping with Frank Schallenberger's way of naming treatments based on combining them with ozone and something else, it's led me to conclude that we need to be looking at treating certain diseases, especially these very problematic autoimmune diseases, with combining antigen therapy, low-dose antigen therapy. We've been calling it LDI, along with ozone, and coupling them up, as I think Frank would be proud to hear that we have. We'll have to refer to this as anti-zone therapy. Anti for the antigen therapy that we have available to us through LDI, and the ozone therapy, the zone part, from therapy we have from Dr. Frank Schallenberger. Now stick with me, you're going to see what I mean on how these two get teamed up. First of all, let me share with you and the listeners some observations. I've been treating Lyme's patients, a number of them. I think we've had about 15 or 20 since April. That's a pretty high number, but it's enabled me to observe how effective ozone therapy has been in 100% of all the patients that we treated. Now that's a pretty bold statement to make, but that in fact is how it's worked out. So that all Lyme's patients that we have used ozone therapy with, and coupled that therapy with ultraviolet blood irradiation, all of these patients get improvements, and I mean substantial improvements. I would say that their improvements are immediate, meaning the day of, the day after, and then lingering for sometimes days following that, that they are substantially noticeable improvements, and that the patient really doesn't have to pose a query to themselves, geez, did it really help me or not? They come in to tell me how effective it was and how it was really enjoyable that evening or the next day and so on and so forth. So almost without being prompted, they fully participate and volunteer how well the treatments work for them. I'll also say this, that in just about every case that I can recall, although these treatments absolutely give immediate relief, and that is substantial relief, in every single case, that relief is short-lived. That's a problem, because we'd like to think that we, as we are dealing with Lyme's disease, able to eradicate it so as to make the ozone treatments become less and less and less, and that really hasn't happened. Therefore, patients who initially do a major autohemotherapy, which another set of letters here stands for the IV administration of ozone, coupled with ultraviolet blood irradiation, I find that the length of time that they can opt out to be able to get the maximum amount of relief before it really can wear down and have to return is about 2 to 3 weeks tops. Now, it's really appreciated by that patient to have that amount of time feeling as good as they can, but in no case, and I have to report this, has ozone therapy, when teamed up with ultraviolet blood irradiation, been able to completely eradicate this disease to the point where we can bring it to a conclusion. And so it was with that in mind that I was very receptive when Dr. Ty Vincent in October of 2014 revealed his results in utilizing a completely different therapy. Of course, his therapy is utilizing low-dose immunotherapy. We now coined it LDI after Ty Vincent's contribution. This was the therapy originally introduced in this country by none other than Dr. William Butch Schrader way back in 1993. But the refinements that Ty Vincent has brought to the table now has allowed us to take another peek at this Lyme disease quandary and recognize it for what it never has been recognized for, and that is Lyme disease, which absolutely starts out as a microbial infection. I mean, it starts with a tick bite, right? And the tick is supposed to be infected with a bacteria called Borrelia. There are many species of Borrelia, but the family is pretty universal. And that a target lesion, a very undeniable and identifiable bullseye rash that can appear in its most classical sense, is sort of the tip-off. Hey, this is the way Lyme disease starts. You better get to a facility, a medical facility, and you should be involved immediately with antibiotics to help to eradicate that bacteria. Now, in those people lucky enough to actually have the bullseye lesion where it's clear to them there's a tick bite here, whether they actually have found the tick and had to remove it, or whether or not they just see the lesion without the tick present, the bullseye lesion is pretty clear. Most people know that that's a sign that Lyme disease looms ever large. And antibiotics, especially one particular class called doxycycline, is the recommended treatment of choice. Now, here's the way it turns out in actuality. If you're lucky enough to have identified this early enough so that you're catching this lesion in the first couple of weeks after infected, the antibiotics alone should be able, I say should, high percentage by the way, should be able to eradicate the disease completely and never allow it to move into its next form. That's the key amount of information that I think has been lacking in the conventional world. They believe, as they have taught, and they have never changed their belief, that Lyme disease is a microbial infection, that no matter when they catch it, what you use is an antibiotic. And by the way, they've thrown every antibiotic known to medicine at this thing, because if it doesn't get eradicated in that first couple of weeks, these demonstrations, these outbursts of the symptoms, are usually treated with another round of antibiotics and another round of antibiotics and another round, and it just keeps going on in perpetuity, never ending. 3 years later, 5 years later, 9 years later, the doctor is going to select another antibiotic and is going to give you another round of them. And oh, goodness gracious, you actually do respond and you improve somewhat. And so the doctor's feeling very good about himself. You're happy that the doctor prescribed the antibiotic. And this is the relation, the symbiotic relationship developed between a patient and the doctor with respect to how this gets treated. Why was it? Why is it that the conventional medical community didn't figure something else was up? That, okay, early on, antimicrobial therapy is the treatment of choice, antibiotics are the treatment of choice, and in the early stages, the turnaround, correction rate, eradication rate is extremely high. But once a point is reached, it becomes an extremely lousy and terrible therapy, and the disease never gets eradicated. This is why the conversation that was held in Albuquerque, New Mexico, when Dr. Ty Vincent presented to the group of LDA doctors who were all in attendance there, we were very receptive to Ty Vincent's identification of the missing link in this disease. And that missing link is that Lyme disease, Although initially a microbial infection, and in the initial days can be treated as such and only requires treatment with the proper antimicrobials, at some point turns into something else. And the something else that it turns into is apparently being ignored and missed by the rest of the conventional medical community, because that something else that it turns into is an autoimmune disease, which the medical profession, conventional that is very poor at treating anyway. So they got two problems. One, they don't even recognize that it is an autoimmune disease, so that's not helping them. And even if they did, the best they could do with it is to prescribe those steroids on an occasional basis. And I don't know, well, maybe it's humane to be able to prescribe them, but it still gets them nowhere because there is no eradication of the disease, which every patient wishes and hopes that there would be. So we thank Ty Vincent for coming in with what I believe to be the piece of information that was missing. We heard Ty Vincent tell us, well, I reported back to you that when he was on the stage in Albuquerque, that at that time he had treated some 40 patients who had Lyme disease, and with an LDI approach, he claimed that he was able to reverse 38 of them. Now, 38 out of 40 isn't bad. Then he came on the show in December, and one of the final questions that I asked him as it was coming to the conclusion of the show was, hey, Ty, last time I saw you, you had treated 40 patients, and I had 38 of them doing much better. What's the number now? Well, he said the number is well into the 80s, and the success rate is well into the 95%. I'm sure that each and every time I talk to Ty, that number is going to be upgraded, updated, but the percentages are probably going to stay the same. And so it looks as though we've learned a great deal from Ty Vincent, that Lyme disease has an ability to be conquered if LDI therapy is utilized. Now, I got to say this, and maybe it will change, but what is going unsaid here is that Ty Vincent isn't able to correct Lyme's disease to the point where these people don't need treated anymore. That's what I believe I had to bring to the table. That Ty Vincent, having such great successes with turning people's symptoms around, never is able to get them to the point that they're done with the treatment. Now that has a similar ring to it from what my experience was with ozone therapy and ultraviolet blood irradiation. It appears that in every case, we get a substantial improvement by people who do ozone and ultraviolet blood irradiation. And at the time we started these treatments, we didn't even know to use low-dose immunotherapy. And so we were happy with the results we were getting. Patients were pleased that their symptoms could be reversed, rectified. But the realization was we are not going to conquer this disease to the point where patients don't need to have further treatment. I mean, doggone it, the same thing isn't happening with Ty. He's able to get tremendous results because he treats the autoimmune component, but Ty doesn't use ozone. It's sort of a, I don't know how things stumble into. Trained in ozone therapy as I am by Frank, utilizing ozone, getting great results, I find that the pathway to follow is you must combine these two therapies. Consequently, if you combine antigen therapy, low-dose antigen therapy, sometimes called LDI, with ozone therapy, it's just a natural to have to refer to that as anti-zone therapy. I gotta complete that by combining the two therapies together. I guess we can affectionately refer to it as AZT for anti-zone therapy. But here's where I believe that we're going to be able to conquer, because the combination of aggressive ozone and ultraviolet blood irradiation when combined with the low-dose immunotherapy done consecutively and concomitantly, is, I believe, going to be able to yield us much better responses, much quicker responses, and definitively allow us to completely conquer the disease. So neither of these two treatments needs to be continued ad infinitum. Now, I can't at this point say for sure that that will happen. It's just too early in this. But I'm sharing with you that you have a Lyme's headquarters treatment center here available. And I believe the public has got to know that if Lyme's disease is the issue, that you're really not going anywhere with that in the conventional community. They're completely frustrated over this. They're almost like, oh my God, do I have to do antibiotics again? It's just not, when you're dealing with frustrated physicians, you as a patient will equally get frustrated because it looks like you think you're just bothering the guy. He feels like he's being bothered. You sense that he's being bothered because he can't conquer it. He's frustrated. I'll get it, like I'll get out. So how about trying a therapy that now takes two completely different approaches? But in this case, I believe that's the magic of why it should be completely successful, because this disease starts out as a microbial infection. It remains a microbial infection, but when only treated as a microbial infection without the autoimmune component, you can't win. And I claim that as good as the results are with dealing with the autoimmune component, you never can fully eradicate the microbial component, and so consequently, you never get completely better with that therapy either. I say, you got to combine them. And oddly enough, having the rare capability of being able to be trained in both has led to a new approach. I now share it with you. So be looking to treat Lyme's disease with antizone therapy. By the way, I feel that there are other diseases in the autoimmune list, and I went down, I must have been 20 or 25 diseases the other day. That's the show I talked about that's up. And if you're looking and you're hearing my voice today and you're wondering, hey, where is that list? Go to djcmd.com, click on the icon marked Archives, and scroll to January 14th, 2015, and that's the show on the list. I'm not going to go over the list right now, but it's a lengthy list. Of that list, here are the ones that look as though they're going to require the dual therapies that I just described a moment ago. This AZT therapy, this anti-zone therapy, and I put Lyme's at the top of the list. Here's my additional few that, as I looked at the list, certainly have to have a double whammy, have to have the antigen therapy with the ozone, and here they come. All of those diseases associated with it is called IBS, I believe, qualify to be both microbial as well as autoimmune, and those specifically are things named like Crohn's disease and ulcerative colitis. These two are autoimmune for sure, but they are microbial for sure also. AZT therapy, I believe, is the way to go. Next, these other two, problematic as they are, fibromyalgia and CFIDS, which is chronic fatigue immunodeficiency syndrome. This is that combination, that double whammy of microbial infections and autoimmune diseases working hand in hand, because I have observed that both of these treatments work. Combining the two in this thing called AZT should yield us the results that I claim are possible. Another group of diseases, recurrent tonsillitis in kids. I believe a streptococcal component is working hand in hand with an autoimmune component. which leads directly into another childhood disorder referred to as PANDAS, which is a pediatric autoimmune neuropsychiatric display of symptoms that are strep-related, streptococcus-related. Now, if other ones get added to the list, I'll be certain to let you know. But as it stands right now, in my opinion, if I feel that you qualify to be considered with one of those diagnoses, you really should consider, as I will propose to you, getting very aggressive with AZT, not ozone therapy alone, not LDI alone, but the combination of them together is producing and will produce, I believe, the definitive answer for these very problematic diseases that neither of the treatments alone appear to be able to conquer to the point of full eradication. And I'll let it go at that. And I'll include this in my series of 5 shows to be continued. Oh, in about a year, I should be able to come back and take what I'll consider this to be a postulation and see how it has actualized over the year. And I'll report back to you. Okay, let's take a short break. When we come back, I'm going to open it up to you. You got questions or comments on AZT, please bring them my way. Want to talk about microcurrent and Shannon coming next weekend? That's fine too. How about Ty Vincent all by himself, setting the world on fire with antigen therapies? All these and more when we return. I'll be right back. Good morning, ladies and gentlemen. Welcome back once again to AIM Impact on Your Health. Heard here in KHB 620 each and every Monday, Wednesday, and Friday from 8 to 9. I'm Dr. Dennis Courtney with you today on a Wednesday morning version of the show, and having just completed a little bit of what I believe is breaking news on how to deal with a terrible disorder and group of disorders that have a relationship to autoimmune that had never been recognized before. We thank Ty Vincent for bringing that message to us, and he's working so well with the use of low-dose immunotherapy up there in Alaska, as well as, by the way, should you know, the Kona coast of Hawaii. But we're seeing that that there is a way to treat ozone that whenever LDI wasn't even considered in the ballgame, we're doing pretty well. Patients were getting wonderful results. So it's this combination I'll be letting you know as time moves on, how patients are responding. Plenty of Lyme's patients out there, no doubt about it. Once a Lyme, unfortunately, always a Lyme patient and nothing but frustration over years and years of frustration. And to think that it's on the brink of being able to be conquered is very exciting, and I hope to continue to share it with you. Now, the microcurrent, by the way, is really taking a foothold too in this office. We have patients who are on these devices each and every day, coming in usually for other treatments, and they're saying, well, what about this and what about that? I want to let you know that as we see you for whatever it is you happen to be coming to us for, there more than likely is a microcurrent program we're going to let you try out to see if it's going to benefit you in any way, because I believe that microcurrent might be, I say might be, the third thing to add on. Now, I don't even know what we'd call the treatment then, but microcurrent having such a role to play in all, let's say this, chronic pain problems, absolutely a must when it comes to the potential of microcurrent. Neurological diseases. Boy, if we haven't learned through the help of Dr. Ed Conrad on how well neurological issues like your vision can be restored, corrected, and begin to be corrected in as little as 3 days. Dr. Ed Conrad, my hat's off to him, because although he didn't invent microcurrent, he was the first ophthalmologist, continues to be, I believe, the only one, literally worldwide, who has developed the use of microcurrent to such an extent that his 3-day treatment programs undoubtedly are able to get people turned around in their symptoms. With vision loss, they're able to begin to restore their vision. And we've been screaming this from the rooftops for as long as we've known Dr. Conrad, and in particular since we took over at the helm in July of 2013 and offered these monthly programs, these 3-day treatment programs that he was so famous for developing. So if we haven't learned, when in a specific case like vision loss, and particularly retinal diseases, where microcurrent literally is at the rescue, you can't look at saying, oh, well, this only works if you've got an eye problem. This must have the potential to work no matter what the organic problem is. And let me work out with Shannon, I think, a role that microcurrent may very well play in Lyme disease treatment and others. But if you're sitting out there and you have a chronic pain problem, if you have a neurological problem, or any organic disease, you may just want to be a part of that group that's going to meet with Shannon on the 31st, of Saturday morning. It's an open invite to you. Why don't you dial us up at 724-942-3002. Right after we get off the show, there'll be people in the office. I know we did this on Monday. We were barraged with phone calls, a flurry of them, about 30 minutes after the show was over. If you think that is appealing to you, take us up on that offer. I'm sure Shannon will love to have you in the group, and I certainly will love to have you. Going to be at my office on next Saturday, the 31st of January, 10 o'clock. Just call to reserve a seat. Hey, opening up to you. We're in that gun lap. We're coming around the home stretch. Got about 8 or 10 minutes left to go. If you think you'd like to weigh in on anything we've discussed today, or if you got another thing on your mind that you want to bring to the table, give us a call at 412-825-6262. That's 412-825-6262. I'll listen for that knock on the door, and I will let you in the store. Thinking of that, there's just been a knock. Come on in the store. Hello, welcome aboard. What's on your mind?
Hello, Dr. Courtney.
Yes, sir.
Your repertory of innovative treatments is interesting. I very rarely have heard you talk about stem cell therapy, especially adult stem cell therapy. It might be useful in combination with some of these treatments also. I was wondering what you thought about that.
You know, you're about the 8th person in 2 weeks. And there is a run on this thinking process. And I got to tell you, I'm not prepared to be as conversant on this as I would like to be. Stem cells are just on the cusp of getting their last refinement, and I believe they're going to make it into medicine. They are rapidly becoming a part of what's new, and if it's new and it's available, We'll bring it to you. I'm excited to think that there will be, in 2015, more information shed on this matter. People that I deeply respect, I know, are working in this arena. And although at the present time I'm not working with stem cells, and don't feel adequate enough to be able to tell you, I know exactly what you're talking about. I think that in 2015, I'll be very receptive to that discussion. So the power of the therapies that we have already are showing me that this may be, well, we're talking about Lyme disease and things like it, eradicatable with what we already have. If it turns out that stem cells, no matter where they may be harvested from, or maybe they're autologous, maybe they're coming from the patient themselves, may play a role in refining this even more, I'm all ears. But right now, I don't know of a stem cell approach that claims to be able to help in this arena. Do you know of such an approach by anybody with stem cells that I should check out? Because I'll be happy to bring them on the show.
Well, that's Dr. Telepi up in New York seemed to be having some pretty good results.
And his name is, once again, what?
I think it's spelled C-A-L-A-T-A-I up in New York City.
Okay. And what kind of doctor is he? And what did you read about it? What caught your attention about that particular doctor? What article was it, and what was the claim that he was making?
Well, I just happened to hear part of a radio show, and it was he was dealing at that moment with diabetes, and was getting what he called dynamic results. And I thought that was kind of interesting. And he's a DO, I guess, osteopath. And he was using that in his practice, along with a lot of other, some of the same therapies you used up there in his practice in New York.
Wouldn't you know, the one reference you make with respect to stem cells is the one area that I can remember my own reading. Only in the last, I'm going to say 2 months, there is a breakthrough coming for type 1 diabetics, not type 2. Type 1 diabetics literally have their beta cells of the pancreas that don't function anymore and do not make insulin. And there is a refinement that I've read about, and maybe I read the article written by the gentleman you're talking about, where they're able to take this to the next step. I believe that within the year or two, you're going to see type 1 diabetics actually have a stem cell therapy to reverse their disease, to cause beta cells to regenerate in the pancreas. And I think it's exciting to think that that's possible. So I'm very prepared to get any gentleman. Let me, you said it was did you say Telefy? What was the name of the?
The C, starts with a C, I believe.
Okay.
C-A-L-A-C-A-I.
C-A-L-A-C-A-I. Okay. Allow me to head to the internet myself. I would just love to think that we're on the verge of having that kind of a stem cell involvement, especially in the case where there are no beta cell islet cells of the pancreas, and these type 1 diabetics don't make any insulin. And the article that I read said, hey, it's possible to be able to implant these cells and have them function. And I'm sure all type 1 diabetics are out there waiting, chomping at the bit. But I promise to get somebody on the show who's well-versed in the use of stem cells, and particularly in this one, because the articles that I read led me to conclude this is very close to making it into mainstream medicine. And that was one of the few areas where actually something involving such a new treatment was that close. So thank you for bringing it up.
You're welcome. Thank you.
Okay, thank you very much. Yeah, I've never heard of stem cells being used for the treatment. I was talking about Lyme disease and other chronic diseases like that. I hadn't heard they're being used in that regard. I'll be on the lookout for people to make that claim. But when it comes to this use of stem cells to develop islet cells in the pancreas, yes, I have heard. Hey, got another knock on the door. Come on in the store. Hello and welcome aboard. Go right ahead.
Morning, Dr. Courtney.
Hello.
Hey, what are the symptoms of Lyme disease, and how do you get actually tested for it?
Well, let's take the testing. There are serological tests that none of them are 100%. So right off the bat, I don't worry about making sure that I test for it because the symptoms, well, I have so many people that come to me already diagnosed many years ago because they had a tick bite. Well, that's usually the starter. Of course, there are people that don't ever realize that they were bitten by a tick. Let's just say that Lyme's disease has another name, and it's known as the great imitator. There was another disease in the 1900s that was also called the great imitator. It was called syphilis, and that's because a patient with syphilis could manifest that disease in virtually every body system known to man at the time. And unfortunately, or fortunately, however you look at it, Lyme's disease has now pushed aside the syphilis, which isn't as prominent anymore. I mean, it's still out there, but Lyme disease is taken front and center. So every body system is involved. That means neurological, that means cardiovascular, that means gynecological, that means gastrointestinal. You name the system. So I can't tell you how limitless the symptoms can be. But let's just say this. Fatigue, unbelievable fatigue, and pain everywhere is probably a good starter. And Sam, we'll let it go at that for now. We got Gong and Bill's signal in the background. It's time to get out of here. Thanks for the call.
Thanks, Doc.
Okay. There you have it, folks. Hope you enjoyed the show today. I'm going to include it on my list of go-tos when I put those CDs together. They're coming up probably in a month or two. So I look forward to seeing you on Friday. Baresha Report. We'll have Bethany Neri with us on a heat report, if you know what I mean. Until then, this is Dr. Dennis Courtney saying so long for AM Impact on Your Health.